It makes sense that a hospital would be a place where you can find some of the latest and greatest technological advances. It's also important to make sure those technologies actually improve patient care. One local hospital system that has found the perfect balance is right in our area. That is Licking Memorial Health System, recently recognized as one of healthcare's most wired hospitals for the second time. And it's certainly a source of pride for my first guests. We have Rob Montagnes, the president and CEO of Licking Memorial Health System. He's joining me today along with Sally Arnett, VP of Information Systems. So I want to welcome you both to Daytime.
Good afternoon.
Oh, Rob, Licking Memorial Hospital specifically recently named their most wired list by the American Hospital Association. So first of all, congratulations.
Thank you.
And what is the significance of this? What does it mean for you?
Well, I think what it means, especially for community hospitals, is the technology and the advancements we've made, certainly relative to other community hospitals, but when you look at the list, we are comparable in many categories to the larger tertiary centers that most people would think of as being more advanced in terms of both the clinical technology and the information availability that hospitals would have for their employees and ultimately their patients. Certainly our IT department deserves tremendous credit, but also the physicians, the clinicians, and other employees who have been very willing to be on the cutting edge and adopt some technology that is not common in the industry. So kudos go out to the entire staff, and that's why we're certainly so proud of the award.
Absolutely, as you should be. You know, what were some of the criteria that they were looking for when they were narrowing down their list?
Well, I'll give you some like an overview, and then Sally can get into more of the specifics. But I think whenever we adopt technology, first of all, it's not in any way to try and win something. What we want to do is get information in the hands of our physicians, nurses, other clinicians, and make it better for patient care and patient safety, or get information in the hands of our patients. So we talk about things like availability of electronic health information for patients online through something I'm sure we'll talk about called the patient. Those are the goals, and if that leads to winning an award, that's great. I think those criteria are a part of the award, so it obviously serves two purposes. But we go at this to try and better patient care and put more information in our clinicians' hands, not to win awards. And they sort of just couple together. But I'll let Sally speak to the specifics.
Yeah, let's talk about some of the specifics, Sally. He mentioned the patient portal, which this is really a huge benefit to your patients and your staff.
And it's something, Robin, that we're very, very proud of. It's a big step forward for our community and our patients. It gives them the opportunity to connect real-time, anytime, anywhere, to their own electronic medical record. So if I'm a transplant patient, I need to check my lab values frequently, I need to make changes to my medications, I can actually go on real time. I don't have to wait for a phone call back from my physician. I can just get that value in real time. Also for folks taking care of elderly patients, I know I'm in that situation right now with my own family. I can go online, check my mom's values, make sure that she's doing well, or if we need to make a change, I can do that as well.
And a lot of this, you know, Rob kind of talked about this a bit, but it's not about the bells and whistles of technology. It's about how it's really helping your patients, staff at the core of what they do every day, isn't it?
It really is, and we have been very, very fortunate to have a great team working in collaboration with our physicians, our nurses, our pharmacists. It makes a major change in their workflow and how they interact with the patient. So the goal is to really get them real-time access to the information, help speed up the patient care delivery process, and make it more accurate.
And another one of the technologies that you kind of just released, I guess you've leveraged your wireless network to support patient care. So how does that play into it?
We have been doing wireless actually since the mid-1990s, but our goal really is to get the nurses to the bedside so that we're actually providing, care isn't provided at the nursing station, it's provided at the bedside.
Gotcha.
So if we can get the nurses to be able to document the things that they need to document closer to the patient, they're there spending more time with actually interacting with the patient.
Okay. So Rob, lastly, how does this award really apply to your overall mission at Licking Memorial?
Well, clearly our mission is to improve the health of the community, and one way we certainly can do that is to leverage technology. Having our staff be our most important resource, there's no question about that, but if we can support the staff with this technology, it really empowers them with information to better care for patients. And so you see that synergy when you look at the electronic health records we have in our physician practices and how it interacts with the physician, or excuse me, the electronic health information in the hospital. It's very, very impressive, and it ultimately leads to some of the better patient care that is evidenced by hospital in our mission. And we're going to continue to push the envelope in terms of technology adoption because it will lead to better care for our patients.
Well, again, congratulations, Sally and Rob. Thanks for being with me.
Thank you.
Thank you.